Now, I thought this would be an interesting debate for us to cover on the channel because it's on TalkTV. They always get these union representatives having these debates with these really know-nothing TalkTV presenters. But in this case, the TalkTV presenter is a doctor debating with another doctor about the senior doctor and junior doctor strikes. So I thought that'd be a pretty interesting comparison for us to make about the kind of positions they both hold. So let's watch, let's react, and let's see what TalkTV try, and almost certainly will fail to do, to try and undermine the union movement today. Let's have a look.
Let's go back to the doctor strike now. This is the senior hospital doctors, the consultant strike. We're in the second day of this. I hopefully gave a very impassioned sort of monologue about what I think about the consultants going on strike. These are the top doctors and basically are rendering the NHS pretty useless over the next 2 days. And just in terms of this is the first time the consultants have taken part in strike action since 2012. I think it's worth just telling you that consultants are well paid, whatever they tell you, between 93,000 and 126,000. On top of that,
also worth pointing out, this guy is a pretty bigwig. I think he's the deputy leader of Reform UK, who are like a free market political party. So anything that he talks about being pro-NHS, just take that with a pinch of salt, because really, if he was actually so in support of the NHS, maybe he would join a different political party.
They tend to get paid about 30% more. This is because of the bonus system called Clinical Excellence Awards, and also they work additional hours as well and receive extra payment, and they can do private work as well. Joining me now, Dr. Bob Gill, who is an NHS GP. Good morning to you.
Morning.
I don't know how you stand on this. I'm deeply anxious and concerned about consultants going on strike. I'm not sure it's the right thing to do.
Well, it's the last resort. The consultants have experienced a 25 to 30% real terms wage cut. This is wage.
Again, worth pointing out, every single time we discuss the NHS strikes, the strikes are not just about the take-home pay for the people going on strike, right? When you actually look at the discussions that's going on, things like within the BMA, etc., their discussion is about the future of the health service in totality, right? The health service is one of their primary concerns, and they believe that unless they fix the recruitment and retention crisis and we stop hemorrhaging our medical staff away to Australia or whatever it might be because the government refuses to pay them properly, and be internationally competitive with regards to the salaries of our health staff in the NHS, then the NHS is going to fail because we're not going to have enough staff to be able to have a fully functioning health service. If we lose too many staff, then we're not going to be able to properly fix the issues, because the retention issue doesn't just affect the current level of staffing in the NHS. It also has this knock-on effect where the lack of retention overworks the people who are already there, making them far more likely to leave. And you go into this kind of doom loop where people continue to leave because the pay is bad and because they work long hours, and then they have to work longer hours because people are quitting, and then that will spiral into the place where we're in now, where we have a gigantic shortfall in staff. Luckily, of course, Labour are going to come in and scrap the non-dom tax to pay for a workforce expansion plan that will definitely 100% work. I'm certain of it. But, really and truly, the retention crisis needs to get fixed now. If it means the NHS staff taking a future pay freeze to get much higher pay now to be able to attract new staff immediately and fix the retention crisis immediately, then that's fine. I think that's fine. Take a 5-year pay freeze to get a 35% rise right now to fix the retention issue and nip that in the bud right now, so that it doesn't become this further kind of inflating blob of a problem that consumes the NHS staff.
We have a government that is busy transferring wealth upwards. The economic case for investing in healthcare, after all, staff are the biggest cost in healthcare. We have a problem of retaining and keeping staff in this country. The UK is at the moment the biggest trainer of doctors for Australia. That's what's happening. We have a brain drain, a hemorrhage of staff and experience out of the NHS.
And also, consultants are so important, right? You may look at this and say, well, these people are in the top 5% of earners, for example. If they're consultants, probably the top 2% of earners. They're very wealthy people, the consultants in the NHS, but needs to be competitive. They're really, really well paid because they're really scarce and really specialised. We cannot afford to lose a single one of them, really and truly. So if the existing consultants are going on strike to ensure that we keep as many consultants in the UK as possible, then quite frankly, then it is justified, even if they don't need the money themselves. Because there are plenty of consultants who will happily take, a 30%, 40%, 50% on some cases pay increase to go and live and work somewhere else for better money. So that's a really important reason as to why there's a justification even outside of the personal living standards of the existing very wealthy consultants. Maybe they seem really well paid because the rest of us are so underpaid. I mean, that's definitely the case, but they are still top 5%ers.
Even before the strike, the reason that people are struggling in work because of workload is because of the lack of staff. We have big vacancy problem in the NHS. So it's not all about pay. The doctors realise that unless pay is restored to what it should have been before the austerity imposed on the NHS, we will continue to lose staff to other countries.
So I agree with some of that. So we don't train enough doctors, but that was the problem caused by the BMA in the first place. The government says it will train double the number. That is to be welcomed. But just in terms of, and I understand this, that we need to keep doctors in this country. I've been through medical training, but in terms of keeping them and retaining them, money is part of it. But how does that resonate, do you think, with people at home who are struggling to put food on the table when you're on 120,000, 130,000 and you say, I want a 35% pay lift? I mean, the independent pay review body said 6%, 35% is out of kilter.
Yeah,
Who cares? Who cares? Who cares what the independent pay review body says? This is an industrial dispute. The unions have a right to have a discussion around and a vote on any pay settlement with the government and to appeal it or reject it, and then to maintain industrial action if that agreement is rejected. That's how industrial action works, right? The independent pay review bodies are appointed by the state anyway. They're hardly as independent as people would say that they are, really and truly. And even then, right, Dr. David Ball is correct here in saying that it's not just about pay, right? Losing doctors to other countries, it's not just about pay. And that's very, very true. A lot of them are leaving because it's too stressful. And it's too stressful because we don't retain enough doctors and we don't recruit enough doctors because we don't pay them enough. It's simple market dynamics. We don't have enough people wanting to become doctors in this country or to train as doctors and then move elsewhere for better pay, right? To have this brain drain problem, then that's telling you that you're not paying them enough. It's of the way in which a labour market works. If you want to recruit people, if you want to keep people in the job, you want to pay them as much as everybody else is or more. It's very true that whenever they talk about the earnings of striking workers, they always mention the top earners. It's always consultants on 130k. It's always train drivers on 60k, right? All that kind of malarkey. They never mention the train drivers on median wage. They never mention the consultants on entry wages. Right? They never mention that the RMT represents people earning £19,500 a year. They never mention this. They only ever talk about the highest salary that they can find as a way of kind of performatively delegitimizing union action in the first place. But again, I think this is still, as the consultants are concerned, I think it's still justified based on the fact that this isn't just about the individual living standards of the consultants themselves, but also about ensuring that we do indeed fix the retention and recruitment crisis in the NHS.
Well, the independent pay review body is selected by government. These are government appointees. Don't be fooled by the label independent. If people understood that the wages have been repressed, there has been wage theft from the consultants, where is the money going in the NHS? More and more money is going to service private finance initiative debt and the running of a privatised system. So there's plenty of money there. The government was chucking billions at a failed and expensive pandemic response, 35 billion in the test and trace system. That's all vanished. There's nothing to show for it.
But you see,
it's so true. Yeah, he's absolutely right. So much of the record spending in the NHS includes PPE that had to be incinerated, a test and trace scheme that never materialised and didn't work and was a waste of everybody's money. Could have been spent on upgrading infrastructure, building those 40 hospitals we keep getting told were going to happen, right? That's what we could have gotten out of all of that money that was spent during the pandemic that instead got palmed off to Tory donors, Tory mates, people in the House of Lords, Matt Hancock's mate from down the pub, right? That's all included in this record spending on the NHS. And he is correct. It's more expensive. It's wasteful to have all of these different private contractors taking their little morsel on the decaying corpse of the current NHS and then farming money off of their shareholders when it could be done in-house in the NHS with better paid staff and cheaper with more efficient and better outcomes. That's the thing that we could be doing, but of course that doesn't make the donors to the Conservative Party rich. In fact, and an old ex-Tory MP is the brother of the CEO of Serco, the biggest government subcontractor. So there's clearly something fishy going on. There's clearly vested interests at play here that's stopping us moving back from this subcontraction model in the NHS that wastes money and gives you bad service. Because it's only being done to enrich Conservative donors and to enrich the private sector and to force the private sector and the public sector to compete, rather than having a public sector monopoly that stops the private sector being able to try and siphon infrastructure and staff away from the NHS, deliberately so, to try and force privatisation wholesale.
Hang on a minute. So in terms of the money, we are putting money in, but it's our NHS. We pay for it, and the people held to ransom are patients, and it's not.
The people are getting held to ransom anyway, right? The public are getting held to ransom by the NHS that's being ruined by Conservative policy regardless. That's already happening, and the people who are striking are trying to ensure that the NHS survives in its current form, or in a better form, where we roll back the privatisation, we roll back the Health and Social Care Act, and have a proper public service for public delivery of a high quality service that we used to have #1 in 2010 in the world, right? We used to have the best health service in the world before all of this stuff started happening. And to be fair, even then we were still being crippled by PFI debt, as this absolutely based consultant is clearly pointing out. Mr. Bob Gill, we stan Bob Gill in this chat. He's absolutely right on every single point that he's making. And even though David Bull is saying here, well, it's our NHS, we pay for it, which is, true, it's a collectively owned NHS. The public overwhelmingly supports the doctors striking, overwhelmingly supported the nurses striking. Doctors and nurses are the most trusted profession in the country. And the fact that these rightoids think that they can somehow manufacture consent to get the general public to go against doctors and nurses, when as journalists and politicians, they are literally the two lowest ranked on trusted professions in this country, it's incredibly wishful thinking. And quite frankly, if they want to continue to do it, it's only going to make that gap further.
Acceptable.
Nobody's saying it's acceptable. It's a last resort. The government is clearly not listening to anything else. Clearly, it's not interested in restoring pay. What else do people do? Do they continue to work in a toxic environment, which is chronically understaffed, not enough beds, a dangerous system, which is hemorrhaging staff? What else do you propose they do to make their feelings understood? There is nothing left.
Have you not considered asking nicely? Have you not considered begging and pleading for the government to please indeed do the thing that's the opposite of the ideology that they failed to do for the entirety of the time that they've been in power? Do you think that you want to just get on your knees and beg for the government to stop trying to destroy the NHS from the inside? No, that's really, I've not thought about doing these things, because clearly that's the true answer. Why are you not debating Steve Barclay in the marketplace of ideas rather than being a militant trade unionist? Oh, these entitled consultants wanting to have a functional health service, how dare they? If you enjoyed this video, please do consider liking and subscribing. It does help out the channel and the algorithm. And if you click the bell notification icon, it will let you know when I go live and when I upload videos. If you'd like to follow me on social media, my handle is @NoJusticeMTG, and that is Twitter, TikTok, Facebook, Instagram, Twitch, and YouTube. If you want to support my channel in a more financial manner, you can do so by becoming a member for just 99p, by super chatting, or by supporting me on Patreon, with the link is in the description of this video, and hopefully I'll catch you on the next segment.